Hello, my name is Dr. Cheryl Burdett, and I'm the co-founder and educational director of Precision Point Diagnostics. I wanted to share with you an exciting innovation that we have for you. And this is a profile that it's unique and that it works to cover some of the major processes that we need to unravel for our patient when we're working in an integrated paradigm. When we work in an integrated paradigm, two of the things that we care about most are prevention and what is at the root cause of a condition. And as we think about that, many of us are often are centered around gut-based health. And so profiles that help us in terms of looking at how the gut is reacting can be quite useful. Another process behind, another root cause for many conditions is toxic body burden. And so looking at markers that can help us to define the level of toxicity are also quite useful. Then in terms of prevention, the conditions that we are most likely trying to prevent, as they are the most prevalent, are cardiovascular disease and cancer. The condition that people are most fearful of getting is dementia. So in this profile, we combine well-researched markers that help you to address these key areas in terms of a functional medicine approach. So the first marker that we look at is glutathione, as well as a percent reduced glutathione. We're the only lab that looks at your reduced glutathione, your active glutathione, as well as your total. That's important because some strategies you'll use to increase glutathione, whereas others are used to recycle it back to its reduced form where it can be utilized again. If glutathione is low, we know that this can be a major impediment to detoxification. A leaky gut is a major reason for oxidative stress. So leaky gut can cause a low glutathione. We know that higher levels of glutathione are associated with cancer prevention, cardiovascular prevention, and also the major intercellular antioxidant for the brain, reducing risk of dementia. F2 isoprostane. This is a marker that is indicative of oxidative stress to lipid peroxides. And so when this is high, things in the body with fat are compromised: the brain, the myelin sheath, even membrane fluidity. And when membrane fluidity goes down, the ability to detoxify on a cellular level is also compromised. So we look at this to understand a need for detoxification, but also F2 isoprostane is a major plaque former. And when it is high, it will disrupt the ability of DHEA to convert into neuroprostanes, decreasing our ability for focus and concentration. 8-OHDG is a marker that goes up in response to toxins, whether or not we're talking aflatoxins or environmental toxin. When the body is affected by it, it will go up. It is a marker of DNA damage, so as it goes up, your risk of cancer goes up as well. It is one of the major ways to look at risk of DNA mutations. It's associated with poor mitochondrial function, and therefore can be indicative of a process in terms of cardiovascular disease as well as dementia. Oxidized LDL, the most predictive marker for cardiovascular disease. When we are looking at particle size, when we're looking at buoyancy, when we're looking at density, we do all of those things to gauge how easily oxidized that lipid is. By looking at oxidized LDL, we'll know again if fats are becoming oxidized, and again, one of our most predictive markers for cardiovascular disease. LPS, this is a marker that comes from bacteria, dysbiosis, lipopolysaccharides, bacterial endotoxin, and it can damage LDL, causing it to be oxidized, as well as damaging the heart too. One of the cornerstones of measuring leaky gut is zonulin. Zonulin is the marker that tells tight junctions to open. So when it goes up, the gut is more leaky. This can also be associated with a leaky blood-brain barrier, affecting us in terms of cognitive output. Diamine oxidase, it's made in the microvilli. So when we see lower levels, we know our gut lining has atrophied, but it's also the enzyme that degrades histamine. So a low DAO will result in patients that react to everything. And when we fix this, that can be a real game changer for patients. Vitamin D, we know that it's globally needed, reducing dementia, also associated, when it's low, associated with diabetes and metabolic syndrome, increasing, if we see our patients who are on vitamin D, but it's not going up, that too may lead us to suspect leaky gut. Inflammation is one of those cornerstone processes that can affect almost everything in the body. That's why we also include a C-reactive protein, and glycation is another reason that systems of the body fail. Not just the eyes, not just the kidneys, but a hemoglobin above 5.2 causes the brain to shrink. So when we're thinking about the layers of the onion and where we need to focus with our patient, a profile that combines gut-based health, detoxification, looking at major risk factors for conditions such as cardiovascular disease, cancer, and dementia can be so useful as a launching pad to help us understand where we need to go with that patient and what our next steps should be.